Do you guys want to try some of my pills? No. 22 million Americans annually struggle with substance abuse, and I am not about to become another statistic.
The goal of this video is to teach you what substance abuse truly is and how it affects communities. Also, how to spot the warning signs and to prevent substance abuse before it happens.
What is substance abuse? Substance abuse is a repeated drug or alcohol use that often interferes with health, work, or social relationships. Substance abuse can result from the use of alcohol, illegal or legal drugs, tobacco, and prescription drugs or opioids.
Healthy People's 2020's goal is to reduce substance abuse to protect the health, safety, and quality for all, especially children.
Substance abuse is more prevalent than you may think, with 1 in 5 people struggling with a substance that is either illegal or legal. This means that every single person likely knows at least one person who is struggling with addiction of some kind.
According to Healthy People 2020, 22 million Americans struggle with substance abuse. However, 95% of them do not recognize that they have a problem and therefore do not receive treatment.
Substance abuse has a significant impact on individuals, families, and communities. Some problems that are worsened by substance abuse include teenage pregnancy, transmission of HIV and AIDS, and other STDs, domestic violence and child abuse, motor vehicle crashes, crime, homicide, and suicide are also exemplified by the use of substances.
The national overdose death rate has doubled from 2007 to 2017 among all ages. This is due to many factors, such as easier access to legal and illegal substances, and the massive opioid epidemic in our nation.
The United States spends more than $740 billion annually in cost-related to crime, lost work productivity, and healthcare from substance abuse-related issues.
Nurses play a role in substance abuse involving all aspects of care. A nurse can be influential in the promotion, prevention, treatment, and recovery from all substance abuse. Oh, hi, honey, where were you?
Where do you think I've been?
Was it poker night?
Why are you asking me all these questions? Where's the beer?
I don't know, I think we're out.
What do you mean you don't know?
I just...
Hi, I'm Ellie. I'm going to be your nurse today.
Hi, Ellie, I'm Gabby.
So what brings you to the ER today?
I just have some burns on my arm.
Okay. How did that happen? How'd you get those burns?
Well, I kind of fell.
Okay. How'd you fall?
I was sitting in my chair and I just kind of fell into the fireplace.
Oh wow. Did anything happen before that? Like what made you fall?
Well, my husband came home and he hit me.
Okay.
And I was like sitting next to the fireplace.
Okay. Has he done this before?
Yeah, sometimes.
Is there any substances involved that makes him do things like this?
Usually he's pretty drunk.
Okay. Well, we're gonna get you taken care of, and this is a safe place, and we're gonna get that fixed up for you and hopefully help you out with this.
Thank you so much.
A nurse's role in this situation is to be an advocate for the patient in need. They would also need to care for their physical injuries. The nurse is also responsible for providing education to the patient about their unique situation, and they would need to collaborate with other counselors or social workers to try to alleviate the situation and find a solution for that patient. It's also important for nurses to provide comfort for the patient when they're going through these difficult times. All right, there you are. Now that we got your burn all taken care of, I wanted to talk to you a little bit about your situation at home. Domestic violence can be a direct result from substance abuse, and actually 10 million Americans suffer from domestic violence, so you're not alone. And I grabbed these resources for you to be able to help with this situation. You can choose to press charges if you want to, and here's some things that can help you with that. This one is some people that will help you with talking to your husband. Also some places to stay if you don't feel comfortable with going home with him. Here's some rehab centers for him if he chooses. They'll be able to help him with his recovery and be able to get him just away from addiction and help him with his substance abuse. This one's some counseling groups and some therapies that may help with the situation. And if you don't like group counseling, they also have some counselors that will do one-on-one to talk about the situation.
Oh, thank you so much. I really just want my Harold back, so maybe these will help us.
Yes, we're here for you, and I just hope you guys can get the help that you need. In addition to educating the patient and providing holistic care for them, it's also important for a nurse to develop certain skills to be able to deal with substance abuse situation. These include having the ability to work effectively with physicians, counselors, therapists, and technicians, also having strong interpersonal skills, being able to communicate clear and effectively, also being able to handle stress and remain calm in chaotic situations. They will also need to be able to use assessment and judgment skills, as well as have medicine and mental health training to be able to better deal with substance abuse.
Many warning signs that someone is struggling with substance abuse. These warning signs relate to teens all the way from ages 13, 14, 15, all the way to adults who may have just recently started substance abuse. The big five are changes in appetite or sleep patterns, deterioration of physical appearance, withdrawal from social or important activities, unexplained need for money or secretive about spending money, and sudden changes in friends or locations. With appetite or sleep patterns, a lot of drugs either make you stay up really late or you eat very different foods. That is a very common warning sign. Deterioration of physical appearance could just mean that people, they don't look right. They don't feel right. They may appear disheveled or just way too tired or irritated all the time, just different. Withdrawal from social activity could be someone that normally is very into studying or going to their sports practices and then suddenly just stops. Unexplained need for money could be due to the fact that drugs are very expensive and that they don't have a high enough income to continue on with this negative habit. Also, sudden change in friends' location could mean they're going to different places to buy substances, or they hang out with the wrong people in the wrong crowd. When questioning someone you think might have a substance abuse problem, it is important to keep in mind that they will likely be very angry, irritable, and potentially in denial that you're even asking them about this. It is often a very sensitive subject, so it's important to be very careful when questioning them. However, you do need to keep questioning them so you can get at the root of the problem. A lot of times, substance abuse is a sign or a cry for help. The person needs assistance. They want someone to know that they have a problem. Keep asking questions. If it gets too out of hand or you feel uncomfortable, don't be afraid to ask for help from outside sources such as parents, other family members, friends, or even counselors. Together, we can make substance abuse a lot less prevalent than it is right now.
The most important way to prevent substance abuse is early and consistent education. We need to start teaching our patients early about the signs of substance abuse, and that it comes in multiple forms, using illegal and legal drugs. On top of that, we need to be sure that our patients are using their drugs as prescribed, especially those that are using painkillers, tranquilizers, or sleeping medication.
Substance abuse contributes to literally hundreds of problems in our society, such as the transmission of STDs, HIV, AIDS, suicide, homicide, rape, child abuse, domestic abuse, and motor vehicle crashes, just to name a few. It is extremely important as baccalaureate-educated nurses to know the signs, symptoms, and education for patients in order to prevent substance abuse in this nation.